So here we are in yet another political cycle and an election hot approaching us. And of course, one of those public debates that we always have during election seasons is the healthcare debate. One side kind of tends to want to advocate of a more public system, and the other side kind of tends to want everything to be privatized, private healthcare, private insurance, private. And it seems to me that we've got these two giant entities just kind of fighting against each other, and we, the people here in the public, are suffering the consequences of it. I do recall that when Obamacare, the Affordable Health Care Act, was passed, leading into that, one of President Obama's promises or claims or selling points, as it were, was that you will get to keep your doctor. When maybe some people weren't able to keep their doctor, that, the whole system's broken because I didn't get to keep my doctor. I played by your rules, President Obama, and I didn't get to keep my doctor. But if you stay on the private insurance with a private doctor and your private insurance through your employer, just doing it the way that the status quo always has been, you'll be able to keep your doctor. Surely that's true, right? Wrong, because that's not the case with me. Let me just say something about the argument about, I get to keep my doctor. A lot of you folks are acting like you went through this long process to find the right doctor, as if you had scoured the countryside and interviewed all the doctors and found the perfect one, and now you want to keep that doctor. Most likely, the way it is with any insurance plan, they give you a list of all the doctors that take their insurance, and then you just either the first one on the list, or whichever one is the shortest drive to you, or something like that. You went off of convenience. You didn't necessarily go off of finding the best doctor. Even if you did do it that easy way, once you started being under that physician's care, you found that doctor and you had built up a rapport, so you want to keep your doctor. As much as I kind of throw shade at the, I didn't get to keep my doctor argument, I also sympathize with it. Because now I am finding that I have to find a new doctor. The firm that runs my doctor's office has decided that they don't want to keep my insurance plan. I'm not on Obamacare. My doctor's office isn't going to be taking my private health insurance anymore. And guess what they're opting for? They're actually finding that it's a better business model for them to only deal with Medicare and Medicaid. Your argument against the public system is now working against me over here on the private system. Just trying to do my best in our capitalist American system that we have here. And it's just not making sense to me. So we have this private business, my doctor's office, just doing their thing in the capitalist system here, trying to make a buck, trying to make all the profit they can, and they're finding that their most profitable model is to exclusively deal with Medicare and Medicaid. And that ain't me. And I have a really good rapport built up with my doctor. So now I've got to start over from scratch and find a new doctor based on the list that my private insurance is giving me. What's the solution? And I honestly don't know what it is. But I do know that this is one of those hot button topics that people are going to talk about in the political cycle that we are currently headed into. The liberal agenda to go to public health care where everybody's covered, which really doesn't sound so bad for me, or you, or for all of us. I think of an African proverb, when elephants fight, it's the grass that suffers. And so perhaps it is these two great elephants, the public sector, the private sector, and they're fighting and we are the grass that suffered. Or perhaps they're not even really fighting against each other. Perhaps it's kind of a spy versus spy situation where, we are led to think that they're working against each other, but they're actually working for each other. I mean, case in point, the fact that my doctor's office is a private company. And they're going to do what they do to make the most money. It's just the way that it works. And I'm not saying it's good, bad, or indifferent. It's just this is a quantitative observation, not a qualitative observation. And that private company is deciding that it's best for their business to make the most money, their fiduciary responsibility, to work with the public coverage sector. And again, I'm Joe Public, just kind of caught in the middle of that little thing. The thing is, folks, maybe it's just not as cut and dry as we think it is. This whole public versus private, corporate versus socialism, or capitalism versus socialism. Maybe it's not really that simple. But if we really want to find a system that's going to work for all of us, we really got to get our shit together, guys. In these videos, I'm ending with the call to let's have a discussion about it. So, without falling into those simple talking points that we hear on either Fox News or MSNBC or whatever, pick your poison, that are given to us time and time again, without falling into the talking points, let's discuss this. And maybe we can enter a new line of thought into the overall zeitgeist or what have you. I don't know. Anyways, that's all I've got. Fuck it. Make something out of this, Glenn. Make something out of it. I'm out of here.